We were interested in finding out whether a woman who might perceive her own risk to be increased compared to her peers was at all associated with a woman's tendency to adhere to what really are the national guidelines for breast cancer prevention, really cancer prevention in general. Right now, the American Cancer Society recommends an adequate intake of fruit and vegetables, 2.5 cups a day, 75 to 150 minutes of moderate to vigorous exercise, limitation of alcohol to roughly one beverage or one serving per day or less. So those are some of the examples of guidelines, and we said, okay, well, if a woman perceives her risk to be increased, she may perhaps be more likely to lead a lifestyle that was consistent with that. So we used the National Health Interview Survey, which is a survey. It's a national survey done once every few years, which surveys literally thousands and thousands of people in their homes, and it statistically represents many, many millions of people nationwide. So it was a good database to use for our study. So we went to this database and were able to sort these women who perceive themselves to be at increased risk versus average or low risk of breast cancer, and what kind of lifestyle do they lead. We were sadly not surprised with our results, and ultimately we found that most women do not adhere to the U.S. prevention guidelines at all, even if they perceive themselves to be at high risk. So it doesn't seem to matter whether or not a woman's worried about breast cancer. It's hard to adhere to these guidelines for a lot of women. We did find that about 95% of women are adherent to the alcohol recommendations. So most women do have one serving or less per day, but we were found that only about a third of all women adhere to the exercise guidelines. So most women are not achieving 75 to 150 minutes per week of exercise. And we were shocked to find that only 5% or less of women get the recommended servings of fruits and vegetables per day. So the implications of this study are probably twofold. One is, it seems to me, or it seems to us, that a woman being aware that she might be at increased risk of breast cancer is not enough to motivate that person to make behavioral lifestyle changes, and that it's either they know about the guidelines and aren't interested or motivated to adhere to them, or perhaps it's an education issue where maybe women are not aware that healthy diet, exercise, alcohol intake have anything to do with breast cancer risk. And so perhaps it's not enough to educate a woman about her risk, but maybe we really need to do a better job at really educating people about what they can do from a lifestyle perspective to reduce the risk of breast cancer.